Hi, I'm Fausto Pinto. I'm past president of the European Society of Cardiology. I'm currently the president of the World Heart Federation. I'm based in Lisbon, where I'm the head of the cardiology department at the University Hospital. The treatment of coronary artery disease, in particular in patients with chronic stable coronary artery disease, has been on debate for a long time. There's been a lot of discussions on what is the best strategy for these patients, if they should be revascularized, if they should be just put on optimal medical treatment. There have been a little bit of a conflict on some of the studies, and I just remind the COURAGE study, the ischemia study, older ones like the RITA study and many others, that still raise some questions about what is the best management for these patients. We know that there are some specific characteristics of the individual patients that, from a medical perspective, may tilt us to be a little bit more aggressive on the treatment of these patients and therefore go into interventions, either percutaneous or surgical, or in some patients using optimal medical treatment. There is a very recent study just published a few weeks ago in the European Heart Journal, which is a very important study. It's a meta-analysis, 19 studies, close to 20,000 patients, and they basically went to compare, and some of these studies are really important studies, and they went to compare and look at the differences between a strategy of revascularization and medical treatment versus a strategy of just medical treatment. And the conclusions are quite interesting. Of course, it's a meta-analysis with all the limitations of a meta-analysis, but it brings some important conclusions that can actually help us to feed in some discussion around this topic of the management of these patients. One of the first conclusions is that in the patients who underwent revascularization and optimal medical treatment, overall, there was a reduction in cardiac death, and this reduction was about 21%, and there was also a reduction in spontaneous myocardial infarction of about 26% in the group that was treated with revascularization and medical treatment compared with the group with medical treatment. There was a mean follow-up of 4 years. And actually, the longer the follow-up, the more these results were very clear. So the conclusion here is that in this set of patients with chronic stable coronary artery disease, the use of a strategy that includes identification of those patients that will benefit from revascularization on top of optimal medical treatment may actually be the best strategy for those patients. Of course, there is still, I'm sure, a lot to discuss around this topic. There are still ongoing studies that may help us to be able to be more tailored in the individual treatment of these patients. We know there are the guidelines, the ESC guidelines that were published in 2019, but overall I would say that to look at this strategy of revascularization and optimal medical treatment may actually be an important strategy for a better management of patients with chronic stable coronary disease. So look at this study, an important one that adds to the lot of information that we already have in terms of different strategies to manage patients with stable coronary artery disease. Thank you.